You are one of 5 of the board-certified plastic surgeons at Plastic Surgery Northwest. Can you start by telling us who you are and what you specialize in?
Okay, yeah. I'm Dr. Derek Fletcher. I'm one of the owners here at Plastic Surgery Northwest, and I'm interested in a fairly broad array of surgery. I've done fellowships in facial plastic surgery, microsurgery, a fully integrated 7-year plastic surgery. So I just enjoy helping people wherever they're at. And when it comes to facial plastic surgery, subspecialty experience I have is facelifts and eyelid surgery and stuff like that. And in microsurgery, we're mostly focused on breast reconstruction. Honestly, I just love operating, love the breadth of plastic surgery, and that's where I come from.
So let's go back to the beginning.
Yeah.
How did you grow up, and were there any early experiences or influences that kind of led you to medicine and then eventually to plastic surgery?
Yeah. Well, we moved around a fair amount when I was a kid, but eventually landed in the Pacific Northwest where my parents were from. My family was just deep in medicine. I'm a 4th-generation physician, and so a lot of the exposure I had growing up was just table talk about patient care and learning about or hearing about different interactions my grandparents had or my father had in medicine.
Awesome. And was there a particular person who kind of influenced the plastic surgery decision?
I first became interested in plastic surgery watching a cleft lip repair. It was just fascinating. You have this very young human, 9 months old, and seeing the immediate transformation from a fairly substantial facial congenital deformity, but has lots of functional consequences, to a person that looks near normal. Whenever the operation is done, was fascinating. The soft tissue management, the technique, how respectful the surgeon was with respect to the soft tissues and precision. All of those things resonated with me, and then to see parents, respond to their baby with a freshly repaired cleft lip was incredible. So then the interest started there, and what I learned over time, which I think a lot of people who don't know much about plastic surgery are surprised to learn about the breadth of it, how diverse your practice can be, how much collaboration there is with other practices, other specialties. It just makes it really interesting and engaging.
So kind of walk us through the early part of your medical career, medical school, residency. Is there anything that stands out from that experience that kind of shaped who you are as a surgeon?
Yeah, medical school. I went to the University of Washington, and the University of Washington has a strong focus on primary care. So I really thought that I was going to be a rural family practice doc when I started. And all of my rotations were kind of focused on that. I tried to get out of the city as much as possible. I didn't want to be the 5th or 6th person in line to watch or learn something, as you often are at in the university setting. But over time, just kind of learned that I wanted to be in surgery somehow, and had a pretty broad interest to begin with. I was interested in orthopedic surgery, neurosurgery, plastic surgery. So one of my earliest mentors, if you could call him that, was a man named Frank Isick, who was an attending plastic surgeon at the University of Washington, who had a broad reconstructive surgery practice in the university and had a research lab. In the process of trying to determine which direction to go, I took a year out in medical school and did research in wound healing in his lab, and then got to observe over the course of that year additional plastic surgery. One of my favorite cases from that year was watching a person who'd had a motorcycle crash with open fractures in their leg, who was contending with a possible amputation, kind of working through the process of how to salvage a leg with soft tissue, like free flap, free tissue transfer to cover a tibia and tendons, and the thought processes that went into that, the other teams that we worked with to optimize timing and postoperative care, and was very detail-oriented and an extraordinary surgeon, and it just piqued my interest from there. Plastic surgery at the time was the most competitive specialty in medicine, and so going into the match was, I think at the time, there were 98 spots in the country and maybe 3,000 people applying to them. I felt super fortunate to get into the number one or number two program in the country at Pittsburgh. And what was interesting then is that they were rolling out a brand new curriculum, which was 7 years, fully integrated plastic surgery from the start, which historically was kind of different. In the past, most plastic surgery residencies were secondary. You'd complete ENT, general surgery, sometimes neurosurgery, and then do an additional residency in plastics and then fellowship after that. But with Pitt, it was plastics from the start. It was a huge program with 25 attendings, which is really unusual in plastic surgery. Usually it's 5 or 6 attendings training people. And the thing that I loved about Pittsburgh was the volume. It's a huge medical system. There were things happening all the time. And I, pretty routinely be walking out of the hospital for the day, and if I saw an attending car in the parking lot that I recognized and figured out they were still doing surgery, I just walked back in and see what was going on and learned a lot about every facet of plastic surgery during those 7 years. But some of the most memorable operations and experiences from that era of my life was this really interesting case where this gentleman had been riding his bike home and he crashed and he amputated his nose and lips in one piece. So he came in without some, major parts of his face. It happened after dark. Thankfully, one of the first responders was just assessing the crash site and saw this piece of tissue on the ground and picked it up, and lo and behold, it was his nose and lips. He also had some substantial facial fractures, split palate, Lafort fractures, all these things. And I was a third or fourth year plastics resident on call, and they called me and said, hey, this guy has an amputated part, can you come and see him? He's in the ICU because his airway was so destroyed. But there was no real urgency in the message. So I was doing something in the ER, sewing something else up, and I meander up to the ICU and figure out that this guy had this critical piece of amputated tissue that was just sitting on ice, and quickly learned that this was an urgent situation because it was on cold ischemia time. We want to get people's tissues replanted as soon as possible. And then thankfully the person on call at that particular night was also just a superb plastic surgeon, someone trained in the whole breadth of plastic surgery, fracture care in terms of facial fractures, microsurgery in terms of replantation, how to manage complex microsurgical procedures that have complications like this one did. We spent, I want to say, 20 of the next 30 hours operating on that guy, beginning by restoring the framework, fracture care, realigning the fractures, plates, screws, wires, and then replanting an avulsed piece of tissue, which is really difficult. When arteries and veins are pulled apart, they're really difficult to repair. Thankfully, it worked. And part of his initial journey was leech therapy, which is this pretty unusual technique of helping tissues drain venous blood, because frequently it's the case that you can get blood in through the high pressure artery, but it's hard to get it out through damaged veins. And so you had this guy who had an incredible sense of humor, with leeches on his nose, leeches on his lip. Don't swallow the leech, trying to keep those tissues alive, and they survived. And then over a course of months, you get to know someone who's been through a really substantial injury, one that is very difficult to hide, that impacts every interaction he has in humanity, navigating some of the emotional difficulties of that, not being able to speak because initially his lips had no motor function. The nerves didn't work. In spite of the fact that you might put them there, they don't have any nerve input for months afterwards. So learning how to speak again, learning how to control food and liquids in his mouth. And then seeing the nerves regenerate, seeing him relearn how to speak, how to navigate humanity, how to establish a new life post-injury was amazing. Another really important part of my journey in Pittsburgh was, at the time, composite allotransplantation, which is where you're taking tissues from another person to reconstruct something. So similar to like a kidney or a liver transplant, was front and center. It was a new technology. Hand transplant was brand new. And I was fortunate that we built the largest, or one of the largest, transplant programs in the world during that phase of my training. Took a year in research, a research year, and was the research fellow for that program. So got to be a part of bilateral hand transplants, unilateral hand transplants, going out in the field to procure extremities from donors, talking about the immune management, trying to refine immunosuppression for hand transplants in preparation for face transplants. And it was a really interesting cross-section of plastic surgery, again, for the same reason. It's every tissue type, nerve tissue, muscle tissue, soft tissue, managing the post-operative care, physical therapy, optimizing outcomes, getting hands to work, getting people back to working jobs independently, not just taking care of themselves independently. Because having a double amputation of your hands, it's extraordinarily difficult to just be a person in the world. So having people wake up and look down and move their fingers because they have them was incredible. And kind of set the stage for my sort of broad approach to training. I learned at Pittsburgh, in spite of doing thousands of cases as a resident, that one of the things I really loved about plastic surgery was just learning from people who did it well. From Pittsburgh, I went to Curtis National Hand Center, which was one of the top hand programs in the country, and learned more about fracture care, ligament reconstruction, tendon management, optimizing hand function after injury. And then from there, went to the University of Pennsylvania for microsurgery fellowship, spent a year there refining my breast reconstruction technique, head and neck reconstruction after cancer, extremity salvage after trauma and cancer. And then my last fellowship was with a guy named Mark Codner, who wrote the textbook in modern upper and lower eyelid surgery, facial plastic surgery, facelifts. And it was very intentional in that process. What I wanted to deliver to my patients after training was a nuanced, informed approach to plastic surgery with input from masters with different backgrounds. So a very common scenario is people go through residency with the 5 or 6 surgeons that they learn from. And they have a pretty narrow sort of perspective on operating, pretty narrow perspective on strategies for injuries that can be managed in multiple different ways. So having sort of a broad exposure, not just in residency, but in multiple fellowships to different thought processes, how to work through problems, complex problems, was an amazing experience, and I'm really grateful for it.
So you spoke to how broad plastic surgery is as an industry. Can you give me specifically what's most appealing to you about it?
There's 2 things. I really enjoy working with patients and learning about them, just what informs their thought processes, what their priorities are, where they're coming from in terms of their motivation for surgery, especially in cosmetic plastic surgery, trying to get into their mindset and trying to, based on that understanding, devise a plan with them that resonates, that's predictable, reproducible, reliable, and safe, and with the highest level of craftsmanship that I can provide. The other part of it's technique. I will never stop learning how to operate better. I try to, as much as possible, stay up to date on best practices, new techniques, come at it with a critical mind, try to parse out what's real and what's might be hyperbole, so that we stay focused on the things that work really well for most people. So it's relationships and technique, trying to do all those things as well as I can.
Do you have a patient story? You kind of spoke to medical school patient stories. Do you have one since you've been in practice for yourself that it has just been the most impactful?
There's so many. I love our breast cancer population. There's just so many brave, strong women, and it's an honor to work with all of them. And the same is true of many of our trauma patients. Injury that's more common than it should be is kids being hit by lawnmowers and losing feet or parts of feet. And one of my favorite memories in plastic surgery as an attending is meeting a 7-year-old kid who had his foot partially amputated. The kind of stress that causes to family, particularly the person who caused the injury in the first place. It's a pretty delicate situation, and you're trying to help everyone recover from it and move on as a family. And to take a 7-year-old kid and restore their foot so that they can go from essentially a life on crutches to one where he can run with the regular shoe is amazing. And that's there's such a resilient population, kids. If you just help them understand that they can recover from something, they will, and they'll adjust, they'll compensate, they'll do all the things that are necessary to move past like a devastating injury like that. Other examples are, I worked with many people who have attempted suicide, and if you put a shotgun under your chin and it doesn't kill you, you have some pretty horrific injuries, and they're difficult to recover from. They're difficult to hide, but having the skill set to put people back together after something like that, and then move past the mental health crisis and become a recovered, resilient, person who can contribute to society and have a fulfilling life. You know, it's life-changing for everyone. It's life-changing for that person. It's life-changing for the team that's committed to their success. So I would say, yeah, our cancer population, our trauma population, there's no shortage of inspiration from those kinds of people.
When you think about being a successful surgeon, what exactly does that mean to you?
Walking into a room in the office and seeing someone at the tail end of their journey who's excited about their result, who experience along the breadth of their journey was positive. They engage with our team. You know, everybody in our practice is critical to the success of the practice as a whole. So from the moment they walk in and talk to our front office staff, to working with our MAs, our PAs, their surgical team in the OR downstairs in our surgery center or at the hospital, it's hearing them tell us that this is the best experience they've had in medicine. That's our goal, is not to emulate anybody else, but to really focus on our own strengths and treat people with as much, professionalism, personalized care, and attention to detail that we can. Probably my favorite thing is just getting people through that entire experience. Surgery can be very scary or intimidating in some cases, and it can be really exciting and fun in others. If you're here for an elective cosmetic surgery procedure that you've been thinking about for years, it's no less thrilling or important from my perspective. It's still the thing that makes going to work fun. It's just seeing people happy on the other side of a comprehensive, focused journey.
So you talked about keeping up on your craft and how that's really important to you. Yeah. How do you go about staying up on research, techniques? Yeah. What's new in plastic surgery? Yeah,
I love reading. Love reading about our specialty in particular. Beyond that, now being a decade into practice and having thousands of my own cases to reflect on, a lot of it's about finding surgeons who are pushing the envelope of quality, craftsmanship, predictable outcomes, new understandings of anatomy. Those are all critical to growth as a sort of seasoned surgeon now. So I seek out experiences abroad. So we, like 1 or 2 falls ago, going to Turkey to learn Turkish rhinoplastic techniques. So there's some really exciting new methods or I wouldn't say new, but refined methods of rhinoplasty surgery that are being done in Europe that I wanted to learn about, that are minimally invasive or less traumatic to the nose, specifically the soft tissues. Also for facelift surgery, there's some really exciting new techniques in facial surgery, refined techniques that allow people to recover more quickly with more predictable results that are very natural. So seeking out people like Mike Nyack or Ben Tolley or T.O. in rhinoplasty, a great experience. And that's just not going to stop. Every chance I get, I'm looking for new ways to get better at my craft, and I'll go wherever I need to go to do that.
You are not just a surgeon here. You're also an owner at Plastic Surgery Northwest. Why is it important for you to have that leadership role, and kind of how do you go about it?
Having a practice like this is a second full-time job. Generally speaking, when we think of medicine, we think about patient care. But here we have 70-something employees, and they're all critical to our success. They're all important. Trying to support our staff as best we can, trying to lead by example in terms of our focus, which is on the highest quality patient care we can provide. And then trying to learn on the way. Like in medical school, we don't learn how to run a business. We don't learn how to manage large groups of people. It's something that you learn when you can, and there are lots of people who choose not to do that. They'd rather be employed by a hospital or a university. And as American medicine continues to evolve, it's become harder and harder to do this. Every year there are private practices in our area that close in all specialties. So the difficulties of running a business, the challenges of running a practice in America now have never been more difficult or nuanced. So it's a lot of it's just put your head down, take care of the people you have, try to evolve as quickly as you can, try to establish best practices and refine them. And we're just committed to continuing to do that.
What are you hoping to take into 2026, or what goals do you have for 2026 as a surgeon and also an owner here?
It's always going to be how to provide the highest quality of care and the best patient experience. And whatever tools, whatever techniques we need to do to achieve that is what we're going to do. one of my, as hard as COVID was, one of the COVID era difficulties of limited access to hospitals, not knowing what was safe in terms of patient interactions and how to protect our cancer patients, for example, who are on chemotherapy and all these things, how to keep our doors open without being shut down. That was a really fascinating experience for all of us. And within our community, we managed that challenge better than the hospitals, better than other practices. We figured out how to stay open for virtually the entire COVID era and how to protect our patients. And so I'd say resiliency, creative thinking, this idea that we'll improvise, adapt, and overcome has been a mantra that we just keep telling ourselves, okay, here's the next challenge. Let's figure out a creative way to move past it.
So for potential patients listening to us right now, how can they find you, follow you, or potentially learn more about what you do?
Yeah. Well, listen to more of these. We'll keep them coming. We'll keep speaking to the things that we're passionate about, keep trying to educate our community on what we do, what our focus is. I have a pretty small social media footprint. I have our website where you can see what we do and how we're trained and our focus is. Mostly it's just come on in. We'll talk about what you'd like to achieve, and we'll devise a plan that's personalized to each individual patient based on 17 years of training and 10 years of practice and trying to deliver the highest level of craftsmanship that we have in every operation.
Yeah, great. Thank you.
Cool. Thank you.